Hello, everyone, and welcome to today's session. I am Dr. Siddhanth Sawant, Associate Professor and HOD of Kinesiotherapy and Physical Diagnosis Department at Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy. Today, we'll be discussing classification and biomechanics of the skeletal muscles. To give you an overview of the sessions, we have divided this classroom into multiple smaller sessions where we'll be discussing the concepts of muscle biomechanics and we'll be understanding how the muscles are classified and what are the factors influencing their force production. So to start with, when I talk about the muscles in the body, there are basically three main types that you can see on the screen. Before I move ahead, I would like you to at least think about which are these three types if you can identify them. If not, then here are the answers. They are basically skeletal muscles, that is the muscles which basically bring about your movements. Cardiac muscles, the heart tissue that we talk about, and smooth muscles, that is your visceral system, which is present into the body. So these three basic classifications have been divided and have their particular properties that we look at. So moving on, let's just quickly see what are the properties of these muscles. So the skeletal muscles are basically striated muscle tissue, which is existing under the control of the somatic nervous system. Now, this is basically a voluntary system that we can control. Now, as a fun question to ask, do you know a muscle that is voluntary? Being a skeletal muscle, it is voluntary only up to a limit, and then it automatically becomes involuntary. Try finding the answer to this question. Moving on, the second type of the muscle is cardiac muscle. Now, this is a specially striated muscle tissue, which is it's basically of heart tissue working automatically and under the influence of the autonomic nervous system. So the first one, the skeletal muscle, was somatic nervous system. The second one was an autonomic nervous system. The third and the last one is smooth muscles. So these are non-striated muscles and they are also under the influence of the autonomic nervous system. They're basically under the influence of hormones as well. Moving on quickly, we move on to the properties of the skeletal muscle. So now skeletal muscles are basically important in our body because they are the primary muscles responsible for our movement. They are the reasons why we can ambulate, why we can perform our daily activities so smoothly. The force that they produce is generally controlled by our nervous system. So we'll be talking about this in detail further on when we actually talk about the muscle receptors and when we talk about the Golgi tendon organ and muscle spindle in our upcoming sessions. They are basically attached across joints. Now, these muscles basically have a type of classification that we look at, and we'll be again discussing this in detail. Each muscle is basically adapted to provide an appropriate range and direction and force of contraction to meet the requirements of the joint that it crosses. So each and every muscle that we are talking about has a particular function that has been denoted to them, and they will act accordingly as the requirement of the joint at that time. Now, why do I say that is because a lot of these muscles have multiple functions as well. And as we go ahead with the classifications, you'll start realizing how the same muscle can be classified into different ways according to the function that it provides. So before moving on with our muscles and the classifications, let's just quickly talk about the properties of the skeletal muscles. So when I talk about the properties of the skeletal muscles, there are distinctively 5 of them that you can see on the screen, and we'll be discussing them in detail. So the first one is the irritability. Irritability is the ability of a muscle tissue to respond to a stimulus. Now, this stimulus can be in the form of anything. It can be in a form of an electrical stimulation, that is the neuro impulse that we talk about. It could be a physical stimulus that we talk about as well. So say a stroking of ice, which is basically the roots principle that we talk about. So that is the irritability principle where the muscle has the ability to respond to a stimulus when irritated or when there is a stimulus which is given to it. Next, moving on, is the property of contractility. Now, when I talk about contractility, contractility is basically the capacity of the muscle to produce tension between its ends. Now, this capacity basically changes from one end to the other. That is, what do I mean by this? Is contractility is something that keeps that varies from muscle to muscle, and depending upon the force that the muscle needs to be exhibiting, it changes. The next is a property which is exactly opposite to contractility, that is relaxation. Relaxation is the ability of the muscle to give up tension. Now, somewhere down the line, why is this property so important is because when we're talking about contractility, it's the tension that the muscle basically produces. Now, when this tension is getting produced, there is some energy that is getting used up or getting converted. Now, this energy needs, there has to be a principle of energy conservation and maximum efficiency of the muscle. And the only way a ergonist can actually perform an ergon, what do I mean by an ergonist? Ergonist is the muscle that is the primary mover. That is the muscle that will be bringing about the movement. So now this muscle, when basically contracts, it has to have the most efficient way of contraction. And the most efficient way of contraction is going to be by conserving the energy. And how does a muscle conserves energy? When the contraction does not have any resistance to it. So contractility will improve when the opposite group of muscle, that is the muscle that is trying to contract, the exactly the opposite group of the muscle is basically relaxing at the same time. So it does not have any resistance to the movement. And that's why relaxation as a property is one of the most important ones, because it helps the muscle to conserve energy. Moving on, the next property is the property of distensibility. Distensibility is the ability of the muscle to be stretched or lengthened up to a certain limit by an outside force. Now, what do I mean by this is, say, suppose if I decide to bend my arm. Now, I'll be using the word bending because, again, since it's the class of basic biomechanics, so we'll try to use the simpler terminologies for now. So when I'm asking to bend my forearm and I'm causing the movement of flexion at the elbow joint, it is automatically the external force that is getting used up instead of the primary muscle force that is going to be the biceps brachii. So instead of the biceps brachii actually contracting, I'm giving an external force and I'm trying to stretch my triceps muscle, that is the antagonist muscle, that is the opposite group of muscle to that of biceps. So the ability of the muscle, rather the ability of the antagonist to be stretched or lengthened up to a limit is what distensibility is about. Moving on to the last property of the muscle, which is elasticity. Now, when I talk about elasticity, elasticity is the ability of the muscle to recoil to its original length. And what do I mean by this is when I've stretched my triceps completely, whenever I remove the external force, the ability of the hand to bounce back is the ability of the elasticity of the muscle that is getting stored, that is the potential energy that is getting stored in the muscle, which then gets converted to kinetic energy to cause the motion. So this is what the properties of the skeletal muscles are. To give a quick overview again, the first one was irritability that you can see on the screen. Contractility was the next, relaxation, distensibility, and elasticity. Moving on, when I'm talking about the function of the skeletal muscles, there are predominantly two major functions that a skeletal muscle performs. One is the mobility. So what do I mean by mobility? Is the ability of the body to move from one place to the other, or the ability of the joint to move over each other. So that's the ability of movement, which the skeletal muscle provides a body. And the last one is the stability component. Now, what do I mean by stability is, with mobility, there is also a concept of stability, which basically means that when a joint is getting moved, or when a muscle is trying to perform an action, the forces that the muscle produces needs to be stabilized. Now, why is this important? Is because the muscle may not be acting always in the same plane. So there are chances that the force that the muscle is producing can be destructive in nature. So when this force is destructive in nature, it the muscles around the joint then starts providing stability to it to negate the forces which are not required. So the non-essential forces that are getting produced along with the muscle contractions are basically negated in the stability of the muscles. And that's why when we see the classifications, you will realize that there are muscles which are called as stabilizers as well. So now when I talk about these muscle functions, there are multiple factors that basically influence the muscle function. And when I talk about the factors, it ranges from the length of the muscle. So we'll be talking about that in detail as it comes in. That the first one is going to be the shape of the muscle or the basic architecture of the muscle. Followed by that, then there is something called as the type of the contraction that is coming in. That again, which includes your isometric or eccentric or isotonic contractions. Uh, Apart from that, there is something called as the physiological cross section of the muscle or the interaction in the joint motions of how the muscles are basically placed around the joint or the number of joints that the muscle travels through or relation of the joint structure and muscle length. Now, again, we'll be talking about muscle length in detail and how it actually affects muscle function in a length tension relationship class. Apart from that, there is the way the muscles getting attached, where the muscles are getting attached. That also plays a very important role, and the amount of myoglobin contents and the fiber type. Now, what do I mean by myoglobin content? Is the textbook definition of myoglobin is the hemoglobin of the muscle. It has the ability of the muscle. It has the ability of to store the energy in form of oxygen, which will help to basically cause a muscle contraction that is required, and of course the fiber type. So we'll be talking about the types of fibers shortly. So these are the basic factors that influence the muscle function. And we'll be starting with the first one. Broadly, they are divided into three aspects, that is structure and architecture, physiology and mechanical. So we'll be talking about the structure and architecture first, and then we'll be moving towards mechanical. So the first one of the classifications is according to the architecture of the muscle. Now, what do I mean by architecture of the muscle is just the way a muscle is being divided or the muscle has been constructed in a particular way. Okay, so there are basically fascicles in a muscle. So when I talk about fascicles, what do I mean by that? Is when you see the structure of the muscle, there is going to be there is going to be a muscle bulk or a muscle belly, which then has muscle fibers. In that, there are muscle fibrils which are present, or the fascicles which are present. So now these fascicles, the organization of these fascicles is how a muscle is basically divided into. So the first part is something called as the parallel type of muscles. So when I talk about parallel types of muscles in in the muscle architecture, so in this, the fascicles are basically provided in a straight line. So as you can see on your screens, it is basically the muscle where the fascicles are not touching each other and they run parallel to each other from the time of the muscular tendinous unit of the origin to the muscular tendinous unit of the insertion. So now an ideal muscle basically has a muscular tendinous origin at the origin, and it has a muscular tendinous unit at the insertion. So depending upon the fascicle orientation between these two units is the first classification that we have. To start with, we started with parallel muscles. So this is basically it depends upon the total number of myofibrils, the tension that gets developed, and it's directly related to the cross section of the muscle. So basically, larger the cross section, more are going to be the muscle fibers. Lower the cross section, lower is going to be the muscle fibers. The thing that you need to remember over here is these fibers, these fascicles will never touch each other, or they will never intersect with each other. Now, if you can see in the cross section over here, they are basically divided into small zones, and as these fibers are placed between them. But as you can see in the cross sections, they have been well divided with the septars into the muscles, and that is something that is classic for a parallel muscle body type. When I talk about a convergent muscle is basically a muscle that has a very broad origin. So the muscular tendinous unit at the origin is going to be broad, and when it moves towards the insertion, it will start narrowing. It will start converging towards the insertion, and that's why it is called as a convergent type of a muscle. So now when I talk about a convergent type of muscles, the fibers basically, or the muscle fascicles over here, as you can see in the cross section, are still parallel to each other. However, as and when you take subsequent cross sections, you start realizing that these fibers have started converging into one end. And that's why they are called as convergent muscles. So now the best example of this muscle is going to be a pectoralis major muscle that is present in the upper girdle. Now, this is a bit of a difficult type to understand. Now, what do I mean by a pinnate muscle? A pinnate muscle is basically a muscle where there is a musculotendinous strand that goes across the two units, that is from the origin to the insertion. And in that origin to insertion aspect, there are these muscle fibers which are placed on it. So the muscle fibers directly find the attachments on the musculotendinous unit, and they are basically placed at an angle. Now, this is something that is very, very important to understand, that when a muscle fiber basically, or a fascicle, intersects with the musculotendinous unit, okay, there is going to be an angle that it causes, and this angle is the angle of pinnation. Now this angle basically is important because it determines the efficiency of the muscle. So a particular muscle fiber that basically intersects the musculotendinous unit at a particular angle causes the angle of pinnation, and a better angle will cause a good efficiency of the muscle. Now, why do we have this in the place in the first place? Because it gives you an added advantage of something called as multiple muscle fibers in a smaller amount of area. What do I mean by this is, for producing tension in the muscle, you need muscle fibers, and body tries to store maximum. It's basically space conserving technique that the body follows. That in a smaller area, there are multiple muscle fibers that are getting placed. Now, why is this multiple muscle fibers important? Is because the number of muscle fibers will decide the amount of tension that a muscle causes. So this is something that is very important. Now, this pinnate muscles are basically divided into two aspects, that is unipinnate, that is fibers on one side of the tendon. The best example of this is going to be an extensor digitorum muscle in the forearm. The next is a bipinnate muscle. A bipinnate muscle, something to imagine a bipinnate muscle, if you have ever touched a feather. Feather is one of the best examples of a bipinnate muscle. An example of a bipinnate muscle is a rectus femoris from the lower quarter of the body. Uh, and the last one is a multipinnate muscle. A multipinnate muscle has, as you can see it in the cross section over here, there are going to be multiple tendons that are present, and they are divided by the septars, and between them is basically the fibers which are placed. Now, one of the best examples of multipinnate muscle is deltoid. So the question is, think about it, and you can drop a comment if you want to. Let me know which part of deltoid. Deltoid muscle has basically three fibers to it. That is the anterior, middle, and posterior. So which part is it, so that a particular part of deltoid is only multipinnate, or the entire muscle is considered as multipinnate? So think about it, read about it, and then drop the answer in the comment section. So as we mentioned in a pinnate muscles, it basically forms an angle with the tendon, which is called as a angle of pinnation. They do not move as far as parallel muscles. What do I mean by this is the length of the muscle fiber in a parallel muscle is basically longer compared to the pinnate muscle group. So in this, because the origin of these muscles, they are basically placed on on a tendon like a feather, the length of the actual muscle fiber is very short. They contain more myofibrils than parallel muscles. Again, as we discussed, it's a part of space-saving technique for the muscles. And because there are more muscle fibers which are present, or more myofibrils which are present, they automatically develop more tension uh, when required. The next is a type of a circular muscle. Now, this muscle basically runs around a particular organ. Okay, in this, the best example is an orbicularis oris. Now, what do I mean by these muscles is both the orbicularis oculi, the orbicularis oris. These are the muscles, they basically act as sphincters, and they are the ones which are basically guarding these openings. They are the ones which are basically guarding these openings. These are the muscles which basically have an enclosure around them, and they are the ones which are protecting it. So whenever they contract, they are going to basically close the enclosure. Whenever they are going to relax, they will be opening the outlet or the enclosure. And that is why these muscles play a very important role in the body. So one of them is orbicularis oris, that is the whistle action that you do, and the orbicularis oculi, which helps you to close the eyes. And the last one is a fusiform muscle group. So a fusiform muscle is sometimes considered to be a parallel muscle because the fibers run parallel to each other. Uh, Apart from that, the advantage of this thing is the length of the contraction that is present. Now, what do I mean by a fusiform muscle? Is a fusiform muscle is basically a muscle which has a typical technique to it, or typical structure to it. That is a fish body type. A fusiform muscle is a muscle that basically tapers down on both ends and has a very thick body type. Okay. Again, I'm sorry, Sartorius has been mentioned over here. The best example of this is actually biceps brachii, muscle that is present in the upper quadrant of the body. So again, as you can see over here, it's the sartorius, which is a parallel muscle, which is a non-fusiform muscle. It is the biceps brachii. This is the structure that I was talking about. That is at the origin and at the insertion, it is tapering, but the belly is thick. So it's quite a fish body-like structure, and that's why it's called as a fusiform muscle. Then it's the deltoid, which is present as a multipinnate muscle. Then we have extensor digitorum that you can see over here, which is a unipinnate muscle. Then we have a rectus femoris in the lower quarter, which is a bipinnate muscle. And we have the pectoralis major, which is a convergent type of a muscle. And lastly, we have the orbicularis oris over here. That is a type of a circular muscle. So at a glance, you can see this uh, as the division of the muscle fibers. So this is the end of the part one of the session. With this, what we have established in our today's session is something called as we have started with the types of the muscles which are present into the body, the three being skeletal, smooth, and cardiac. We saw something important, that was the muscle properties. And apart from that, we started seeing the muscle functions and the factors that will influence the muscle function. That is the primary thing that we were supposed to discuss. Under that, we started talking about the first aspect of the primary of the muscle division, that was depending upon this architecture of the muscle. And under the architecture of the muscle, we started seeing the arrangements of the muscle fibers. So right now we have just discussed the arrangement of the muscle fibers, and we are yet to talk about the multiple aspects of the architecture of the muscles that we'll be talking about where we'll be talking about it in the upcoming sessions. So, thank you so much, everyone, for listening to me and joining in. And I hope you had a fun session. And I would like to thank the entire Physio TV team for giving me this opportunity. I would like to thank Dr. Parag Sancheti, and I would like to thank Dr. Apurva Shimpi, sir, because well, because of them, we have got this opportunity, and I could get a chance to interact with each and every one of you. So, thank you so much, and hope to see you in the upcoming session.